Hello, 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 everyone. Welcome. Thank you for joining us today for our fifth installment of our autumn virtual event series. Today, you'll learn about the home care services offered by MyPotential at Home. I am Adrienne Brown, the sales coordinator here at the Village at Augsburg. You will hear from our sales director today, Suzanne Roos, and also our special guest presenter, Arlen Alvior-Gessi. She is the Director of Clinical Services at My Potential at Home. Most of you have been with us before, so I'm just going to skip on to talking about questions. We will not be using the chat today. However, you will be able to ask questions using the Q&A tab. If you just click on that tab, you will get a pop-up box. Just type in your question there, hit submit, and we'll try to get to all questions at the end of the presentation. So for those of you who joined us a little early, there was a poll question, and that question was, do you have a current need for home care service? It looks like most of you said that you do not need service, and just one person knows someone who does. So right now, I will turn it over to Suzanne.
Hi, everyone. Good afternoon, and thank you for joining us again. For those of you who are rejoining us, thank you for making time to come back today and spend some time with us. And for anyone who's new, welcome to Augsburg. As Adrienne said, my name is Suzanne Roos, and I'm the Director of Sales here at Augsburg. And Adrienne and I would love to get to know you. If you are interested in a tour here at Augsburg, if you would like some additional information sent to you, you can reach out to us, and we're happy to do that. Adrienne and I really work as a team here at Augsburg. We work with any family member or yourself who is interested in moving here to our community to make sure that you learn as much as you can about Augsburg before you move here. And then we guide you through the moving process until you are a resident here. So again, welcome and thank you so much for joining us. For the benefit of those who are new today, I'm just going to take a few minutes and talk to you just a little bit about Augsburg. We actually have been around since 1892, which is a big surprise to a lot of people to realize that we have been established that long. We started out as an orphanage, and we transitioned really into senior care in about 1970 exclusively. We are what's known as a continuing care retirement community, and that just means that we have several lifestyles of options of living here for residents, and that includes independent living, which is apartment style homes here, and also assisted living and skilled nursing care. And in total, on our 52-acre campus here on Campfield Road, we have about 350 residents, and we employ 200 staff. And the team members that work here are here to take care of everyone, whatever their level of living is. And it ranges from dietary staff to administrative staff to nursing staff, housekeeping staff, transportation activities. We have it all. We were known primarily as Augsburg Lutheran Home of Maryland. We are a faith-based community, and up until January, most people knew us as Augsburg Lutheran Home of Maryland or Augsburg Village. In January of this year, however, we became affiliated with National Lutheran Communities and Services, and we are now part of their family of senior living communities. And when we became affiliated, our name changed to the Village at Augsburg. So that is now what you will see on all of our printed materials on our website. We have had a really successful transition through that affiliation, the support that we've received, and all of the guidance that we've gotten has really impacted us in a positive way, and we're really excited about the future of Augsburg under the guidance of National Lutheran Communities and Services. So one of The new components of being part of this affiliation with National Lutheran is that it brings to Augsburg our very own home care agency, which is called MyPotential at Home. And so I would like to introduce now to you the Director of Clinical Services, Arlen Alvior-Gessie. And Arlen is a registered nurse with over 35 years of nursing experience. She is actually going to tell you today about the services that are going to be available here through MyPotential at Home. And those services are available not only to our independent living residents, but also to people who live in Baltimore County. So even if you don't live here yet as a resident, you can have these home care services in your home, or you can register someone else, a loved one who needs those services. So without any further ado, let me introduce Arlen and have her tell you a little bit more about herself and about MyPotential at Home. Hi, Arlen.
Hi, good afternoon, everyone. My name is Arlen, and welcome to this presentation. I'm going to talk briefly about MyPotential at Home and what we do with our clients. So I'm going to share my screen with you guys. Bear with me. Screen.
There we go.
Thank you. Thank you so much, Ms. Suzanne. So MyPotential at Home is a National Lutheran service. For right now, our Ms. Cynthia Walters is our interim healthcare administrator. And that's me, Arlen Alvior-Gessie. I am the Director of Clinical Services for Maryland. And I wanted to share with you a brief history of who we are and what we do. So reaching your potential at any age and at any stage, it's kind of like the mission statement or the goal of MyPotential at Home. We are a home care agency under the umbrella of National Lutheran Communities and Services. We are different from other agencies in the sense that we are licensed and we are regulated by the Office of Healthcare Quality, Maryland Department of Health. So we are called RSA, which is the equivalent of home care and home care agency in the state of Maryland. So when did we start? So 6 years ago in Winchester, Virginia, March to be exact, of 2014, we started to assist residents at our Winchester, Virginia facility, which is called the Village at Orchard Ridge. It is also one of our National Lutheran continuing care retirement communities located in the Shenandoah Valley in Virginia. And our aim was to help our seniors to remain in their homes and assist them in being as independent as possible. So we usually ask our seniors, like, would you rather stay in your home until the day that, whenever you can no longer take care of yourself, or would you rather move to a facility that, the care is more like routine, institutionalized, or whatever? And a lot of times I don't get a yes when we ask them that. So with that in mind, we opened or started our service as a private duty home care agency in the Winchester area. And then we opened our Rockville office October of 2016. The Rockville site provides private duty home care services out of the Village at Rockville in Montgomery County, and we also serve the residents of Montgomery County. We work closely to help the residents here at the Village at Rockville and the Montgomery County community. We plan to open or to extend our private duty home care services to the village at Augsburg in the next 2 to 3 weeks, and that would include Baltimore County in that area. So I just want to briefly explain to you the difference between home care and home health. So when we speak of home health services, it is something that needs a written doctor's order or prescription from the physician. It is often paid for by Medicare or if the client has private insurance. Most often, the client must be homebound. It is short-term duration, meaning that you can't stay on home health services forever. It can be like once you get better, or I think Medicare gives you only a certain number of days, and then after that, you have to be the one to pay the rest of it if you want to continue. If you are eligible for home health, the visits will be made at your house or wherever it is that you are staying by a home health registered nurse, a home health aide, a physical therapist, occupational therapist, a speech therapist, or a social worker. Private duty home care service, on the other hand, which is us, MyPotential at Home in Maryland. We don't have home health service yet in the state of Maryland. We only offer it in our Virginia site. So here we do have private duty home care services. Anyone can call to request for services. A neighbor, yourself, a loved one, a friend, or maybe if you are staying in the village at Augsburg, one of the staff that feels that, okay, I have identified that you might need MyPotential at home. So anyone can call to request for a service. The client or the financial power of attorney must sign a contract, or there are like 9 sheets of or 9 documents that need to be completed and signed prior to the initiation of service. It is like regulated by the government, so we need to comply with that regulation. And this can be of a long-term duration, but it can be canceled anytime as long as you give us 24-hour notice. Some of our clients would hire us because they had surgery and they are not able to take care of themselves for like a few weeks. But once they get better, then they would tell me, Arlen, put me on hold or discharge me. The thing with being discharged is the next time you need us again, you need to sign a new set of paperwork. But what we advise our clients or what we recommend is if you don't need us at this time and foresee that in the future, maybe you will need us again, we will just put your services on hold. We will inactivate your documents or your chart and or records, and then we will reactivate it when you call again. That way you don't have to sign a new set of paperwork. So moving on, so what are the services that we offer to our clients? We do offer personal care and assistance, like assist with activities of daily living, such as bathing, dressing, showers, preparing for the day, assistance in the bathroom as needed, help with transferring to and from a bed or chair, or medication reminders and medication management, which usually the medication management is a registered nurse who will go and review your medications with you, get the orders from your doctor, make sure that we help you fill your pill boxes. And the caregivers who come, whenever you wanted them to come, will be reminding you that it's time for your medications, and then they will help you with that. We also offer companion care or sitter services, which include like encouraging you, encouragement of social interaction, exercise, supporting your hobbies, having someone to talk to with through the day. We also offer light housekeeping and meal preparation. We can assist you with cooking meals, preparing meals for the day, and encouragement to enjoy those meals. Assistance with basic house care, such as trash removal, dusting, vacuuming, laundry, and much more. We also provide transportation and support, transportation and coordination to and from medical or personal appointments, like attending an event in your family, but of course, because of COVID, things are not, are restricted right now. Attending appointments like going to the doctor or even having a hair appointment. We can do that. And we do have designated drivers if you need that. You just have to give us enough notice so we could assign somebody. I'm sorry. MyPotential at Home is an a la carte service to help clients stay in their homes. Caregiving and nursing staff are highly vetted and to meet the needs of our clients. Because we are under the umbrella of National Lutheran Communities and Services, we go through the same training, orientation as any other employee of the National Lutheran, and we are all insured and bonded with the, National Lutheran Communities and Services. So we are here to support you after or during a stay at our skilled nursing facility over there at Augsburg, in your independent living home, or at our assisted living community at the village at Augsburg. So you can visit us. For right now, our office there is not yet officially open, but I'm hoping to open the office on November 16, which is a Monday. So you can come by or you could call, and on the screen is our telephone number. You can also call the Rockville office because we are answering our phones 24/7. The same thing we will do when we start opening our Augsburg office, and you see the number on the screen. And if you have any questions, then we will open for questions. Thank you so much.
Thanks, Arlen.
Yes, ma'am.
So I do want to talk a little bit more in detail about a couple of things. For people who have visited Augsburg before, just to put into perspective for you where this office will be located. When you have come to Augsburg and met with me in the marketing office or come to an event in our cafe, you may have known that our health and wellness offices are really close to that area. And it's actually this MyPotential at Home office will be adjacent to our fitness studio right across the hall from our hair salon. So they have ample space available there. They will also be open Monday through Friday from 8:30 to 5. And on weekends and after hours, there is a number that you can call for an on-call service. So really, they will be accessible to people 24 hours a day. I would like Arlen to talk a little bit more about, well, several things, but let's start with the process of determining if someone needs some support. So you mentioned that, a family member could contact you, or the resident themselves could contact you. Sometimes, though, it is a staff member. A lot of our residents live here independently without any family nearby. And one of the things that we have instituted within the last few months is we have a weekly meeting with several team members to talk about independent living residents specifically that we know are vulnerable or have had recent surgery, or maybe they are transitioning from one level of care to another. And so this team, there's about 5 of us that are on this call every week. We know which residents from our own personal interactions with them are potentially going to need some support. And typically what we do is we first try to reach out to the family, of course, and let them know that we are noticing some changes that might require some help and some support. And at that point, we, either myself or maybe Tina Minio, who's our resident services manager, would then connect you with Arlen and her team. So at that point, Arlen, what happens next?
So if someone calls us, what we usually ask is there a power of attorney? If the client is alert and oriented and is his or her own power of attorney, then we will talk directly with the client or with the resident. If it is a family member and the family member is in the area or wherever they are, we usually just ask, is there an email address that I could send information to? What I usually do is I email the information, I email the paperwork that needs to be, reviewed and signed. And if the family member or the client agrees with everything that's in the documents, then we instruct you to sign. You could do a DocuSign. Like you don't even have to physically sign. You can just sign it through the computer that we send you. But I have noticed that a lot of times family members who are not really computer savvy will say, well, just mail it to me or whatever. So we can do it different ways. But the contract, which is usually 8 pages, and then 8 other documents that the government requires us to complete, needs to be signed, and then we will set up an assessment day wherein the one of my nurses or I myself as an RN is at Augsburg. It will be Margaret. You're going to meet her she will start being there in the office next week, starting Monday. We'll pay a visit to the client, and then we'll do an interview, a head-to-toe assessment, just like when you're in the hospital. A nurse will come into your room, will check your vital signs, temperature, blood pressure, everything. We'll try to find out what is your medical history, what are the needs, like every person has different needs. I know I see a question about medication management. Some people might not need that. They might need only assistance with getting up in the morning, getting dressed, or help with showers. Some people like showers every day, some 2 to 3 times a week, or help with just getting ready, and then that's all that they need. So we do that, and then the RN is going to interview you or your loved one. What are the things that you need my caregiver to do while they are here? And then we try to see if we could cover that within the span of time that you want them to be there. And now the RN is going to come up with a care plan. That care plan will be in the computer. The caregivers, when they start visiting, they don't have their computers with them, except of course for the RNs, will always have a computer. But our caregivers carry a cell phone with them. And the cell phone has the home care app. All the tasks that they need to do while they are with you or with your loved one or with the client will be listed there. And that will be their guide. While I'm here, what am I supposed to do? Today I have to help with shower. Today I have to clean, prepare the breakfast or lunch or dinner, or I have to help with the laundry. I'm scheduled to make the bed and stuff like that. So it will be very detailed and individualized based on the need of the client that we have. And then after that initial meeting with the RN, we will visit you again every 90 days, not more than 90 days. And I just want to tell you that we do not charge for a registration or admission. It is free. When I know that other competitors or other home care agencies charge from $90 to $125. National Lutheran doesn't charge anything for that. And then again, they will charge you every 90 days to pay you a visit. What do? We want to make sure our caregivers and you are happy with the service. So we do this. It is again free. We follow up. We do spot checks with our caregivers to make sure that they are doing what we expect them to do. all of our caregivers are certified nursing assistants. Some of them even are geriatric nursing assistants. So they are all licensed. We don't have no non-licensed staff. And they go through thorough orientation. We want to make sure before we release them to be with you that they went through good training so that they are confident, and be able to take care of you, even if we are not there. That they will be by themselves, but we are a phone call away. So that's what happens. And then anytime that there is a change, the caregivers know that if they notice something has changed, like your skin, you have an open area, or all of a sudden you seem to be weak, you are not eating, like you lost weight or loss of appetite, and it changed in behavior, all of a sudden your loved one became confused, or more confused if they are already confused, if they have like cognitive impairment, our caregivers know that they need to pick up the phone and update me or one of the nurses working with us. So that what we do is we do an investigation. We either pay you a visit to follow up or call your primary physician or whoever it is that's taking care of you. So and we also try to coordinate with your loved one, or if you are a family member, we update you with what's going on with your loved one. And then we try to coordinate care so that we make sure that whatever is the problem, that problem is resolved or addressed. So that is also one of the things that our RNs do. And it is part of our case management that our RNs are doing. So I think the question that's there is medication management. It is an RN who comes and will set up the pill boxes. We will charge you a minimum of 30 minutes for that service. It is $40 per hour, but just to set up, unless we go beyond that, because initially we have to review, we have to coordinate with your doctor. Is this the correct medication list, and so on and so forth. And so that's one of the things that we do.
Okay, so that's a lot of information for people to digest. And also, folks, we are recording this webinar today, and I am happy to send it out to you so that you have it and you can watch it or share it with your family. Arlen did mention the cost for the medication management. And that you said, Arlen, was $40 an hour for medication management, but that is not the hourly rate for, for the care the home care services. So let's talk a little bit about that briefly, because people always do want to know how much is this going to cost, and does Medicare pay for any of it, or does my long-term care insurance pay for any of it?
Yeah, unfortunately, we are not paid for by Medicare. What we are is a private duty home care agency. So the funds are coming from our clients or whoever is the financial power of attorney. We do work with some long-term care insurance companies. Like if you have a long-term care insurance and one of the things that you are eligible for is home care, they do pay for that, but we do not deal directly with them. What we do is to you pay us first, and then you tell your long-term care insurance that you are using us, and then they send me paperwork to fill up. I will complete that paperwork with a report. Why do you need home care? What are the things that you need? And so I send it back to them, or our billing office sends it back to them with your care plan, and then they are going to reimburse you. They're going to send you pay, but you are the one paying us first, but you get a reimbursement from them.
Okay, and then Arlen has shared her screen of her slide that shows what the fees will be here at Augsburg. And again, we can make sure that you get a copy of this so that you know. But this is typically what you're going to be looking at is $25 an hour for care. And
Right. And for residents of the village at Augsburg, our minimum is just 1 hour. So if you don't need us for more than 1 hour, we don't want you to hire us for more than 1 hour. I know that outside agencies, meaning outside if they are not part of the National Lutheran or the village at Augsburg, they're not going to come to take care of you if it's less than 4 hours, or usually here in Montgomery County, 4 to 6 hours. They're not going to send someone. They will require you to hire them for that number of hours. But if you are a resident of one of our communities, we only charge a minimum of 1 hour. And then if you are a resident of Baltimore County in that area, then our minimum is 2 hours.
okay, so it's a good reminder to know what we're talking about today. We're kind of addressing it specifically for our independent living residents, but keep in mind that, as Arlen said, all of these services are available to people who don't live at Augsburg yet, but live within Baltimore County. So if you know someone, or you yourself, maybe you have some surgery coming up this winter and you're going to need some support, this is an option for you to take advantage of when you need it. One of the other things, a lot of people, when I first meet them, usually there's a reason why they are ready to move to an independent living setting. Sometimes it's simply because they want to downsize and they're ready to get out of owning a home, and they want to come into community where they have neighbors and they have services provided for them. But more than likely, there is an underlying medical reason that they want to be in a continuing care retirement community, because they are anticipating a change with their health. And so having a service like MyPotential at home right here in our building is really going to make a difference for our residents. They themselves will be able to walk into the office during the office hours and talk with our nurse. Her name is Margaret Okasola, and Margaret is actually coming to us from our assisted living facility. She is the delegating nurse right now in our assisted living community. She's making this transition here. So what's nice about that is that Margaret already is a part of Augsburg. She knows our community, and she has a lot of experience working with our assisted living residents. And so coming into our independent living setting, she really will have a good eye for what their current needs are, what they might anticipate needing in the future. And having access to her, I think, will be really beneficial. Along with Margaret, and Arlen, you can jump in here, there will also be caregivers who will be the actual ones going in to give the care. Margaret will do the assessments, or yourself when Margaret's not available. Arlen will not be here at Augsburg on a daily basis. Her office is in Rockville, but Margaret will be here. And one of the things that we would love to do after the office is open is to schedule appointments for you to come in and see the office and meet with Margaret, and maybe pick up some materials and get a better understanding of how that service is going to work. And we can arrange that by appointment. We want to be mindful of current COVID situations. So you can have access to that and learn about it with more detail if you'd like to come in. Arlen, I do also, for the benefit of everyone watching, we are still in a pandemic. So can you talk a little bit about how your caregivers and nurses are prepared when they are going into work with a resident to protect themselves and the resident from COVID transmission and the spread of the virus? What kind of things are in place for that?
So for us, since we are under the National Lutheran Communities and Services umbrella, we follow the same COVID protocol that is required of employees of National Lutheran. Although in the home care industry, we are not really required by the government to have a weekly testing, but because we work in the building, and our office is in the building, we cannot enter the building. We are not allowed to enter unless we get tested every week. So for instance, for me, I get tested every Monday. And then if for any reason, like one of my caregivers, was noted to be not in the list of those that were tested, the infection control preventionist sends me an email, and then I'm going to tell them, go to CVS or somewhere else. You need to be tested or you cannot work the following week. So and we do monitor their symptoms, and they are supposed to report to me if they have, for any reason, any symptoms at all that might be indicative of COVID, or sometimes even if it's not COVID, but we still treat everything that's related to COVID as if they were positive. And we advise them to quarantine, self-quarantine for 14 days until they are no longer symptomatic.
Okay, good. If you, Arlen, if you can take your slides down, I want to share my screen with everyone. I want to, let me see if I can do this here. I do want to let everyone know that MyPotential at Home does have a website that is very helpful, got a lot of information. Let me bring it up here. And hopefully you can all see this.
And while you're doing that, Ms. Suzanne, I just want to remind everybody that you don't have to wait for that day when you need help from us. I encourage our residents to register in advance. It is free. It is, you have enough time to read the paperwork and to sign, and just, send it to us. We will register you so that once you need us at that very last minute, all we do is send an RN and check on you, and then we can start service immediately without having to wait for paperwork to be signed, because we are not allowed by the government to touch you unless we have assigned paperwork.
Perfect, thank you. So let me know, Arlen, when you can see where it is. Here we go. All right, so you can see, for anyone who wants to get some additional information when we're done today, mypotentialathome.com. And I just want to point out to you that this website hasn't been updated yet with Augsburg or Baltimore County. So when you look, it'll say Winchester, Virginia, and Montgomery County. But we are, as Arlen said, within a few weeks, we're going to be open here. So even though it's not mentioned yet on this website, it is still a service here. There's a lot of good information on this website, and I really do encourage people to look through it. There is also, Arlen, on the website, it says free in-home consultation, learn more here. There's also a page where you can schedule a consultation, and there's an online assessment. Does that come directly to you? Where does that form go if I fill that out?
Right. When you fill that out or someone fills that out, it goes to our marketing liaison. And then depending on where your address is or where the client is located, that will be forwarded to either the Virginia director, or in Maryland, it will be forwarded to me.
Okay. And so that's a way for people to reach out to you.
Yes.
So I wanted to just share this briefly with everybody so that you knew there was additional information that you could get out there and learn a little bit more about MyPotential at Home. Are there any other questions that are specific to the registration process or to the caregiving? Anything that we can address for you this afternoon? If not, I'd also like to talk a little bit more about, for people who aren't living here yet, or maybe they have, really no intention of moving to a senior community for a couple of years. Arlen, just to clarify, this process works the same for people who live outside of Augsburg. So they're not going to have the office to walk down the hall to see Margaret. So they will just call her or go on the line to request a consultation.
Yes. And we could do something like this, like a Zoom or Skype meeting. Or sometimes if some people are not tech savvy, we do Facebook, the Facebook Messenger. So we can do it any which way, or, if the client agrees, I could send the nurse, or I could go and be with you face to face or whatever. Of course, following all those social distancing and mask and everything. So yes, we can do that.
Are there any other services that you will be providing here? For example, a flu shot clinic or blood pressure clinics, anything like that will, our residents can take advantage of?
At the village at Rockville, before COVID, we used to provide free blood pressure clinics 3 times a week. So we would be available, residents or their family members, sometimes even staff, would come to visit. And it's an opportunity also for residents and family members to sit down with us and to just check. They ask for advice. What do you think should I do? And usually, if we recognize that you need the help of your primary care physician, we will redirect you and say, well, your blood pressure is not doing good. Could you please call? And,
Good.
So we offer that. Yes.
Good. So I think, Arlen, you've covered a lot of ground here today, explaining the services, explaining the process of how folks will reach out to you and get registered. And also, I do want to let everyone know that our plan going forward is that when a new resident moves to Augsburg and comes directly into independent living, you as a new resident, you always receive a MoveIn packet from Adrian. Adrian prepares that, and it has a lot of paperwork in it that includes, who's your POA, what kind of phone and internet and cable service do you want. We are going to start including in that packet the registration forms for MyPotential at Home. And the reason we want to do that is because we would like to get every resident registered. As Arlen said, there's no cost to you to do it, but we would like to have you registered from the beginning of your residency here, because when you do have an emergency or there's a need that comes up, we want to make sure we've already got all the paperwork that we need completed, and then the assessment can be done and the service can begin really quickly. So I think, for folks who are going to be moving in, that will now become sort of routine as part of your packet of information. And I think it will help make everything just that much more smooth for people once they're a resident here. Any other tips, Arlen? Any other things that you want to share before we wrap up this afternoon here?
I don't think so. I think I have given enough information.
Okay.
I wish I could give my little goodies to everyone who attended, but
your little swag bag that you give. Well, thank you, Arlen, for spending some time with us.
No worries. Yeah, you're welcome.
As I said, folks, we have this recording available to you so we can send it out to you. We have one more virtual event coming up next week on Tuesday. If you're able to join us, it is called Family First, and that will be a discussion with 2 family members who have loved ones living here currently in our independent living community. And that will be a really interesting and fun discussion with them. A lot of times we focus on the residents here and the services, of course, but I thought it would be really helpful for you to hear from family members who have helped their loved one make the decision and help them through the process of moving here. And they can talk to you a little bit more about what that's been like. And especially, we'll talk a little bit about what it's been like to have them here during 2020, which has been a very memorable year for all of us. So thank you so much for your time this afternoon. Thank you to Arlen. I do encourage and welcome you all to make a visit out to Augsburg in the near future to schedule an appointment. You can come and meet Arlen or Margaret and see their office space, but you can also come if you're interested in a tour. We are open safely, providing tours of independent living apartments. So if you want to come out and say hello, would love to see you. Everybody has to be in a mask. There's a screening process, but it is something we can do. And if you're not comfortable coming out, but you'd like more information, or you want to see a virtual tour, we can do a virtual tour of an apartment, and we'll get a virtual tour of MyPotential at home. And that way you can see that as well. So thank you, everyone. I hope that you continue to remain safe and healthy. And on behalf of everyone here, thanks so much. Take care. See you next time.